Do you aware that more than 50% of heart attacks provide warnings a significant amount of time in advance? Moreover, the fact that the majority of us are unaware of it is even more astonishing. Your body is truly communicating with you by providing you subtle messages that we frequently refuse to pay attention to. Take into consideration the possibility that anything that appears to be nothing more than normal weariness, or possibly even just a slight ache in the chest, could actually be an indication that your heart is in serious risk. An assault on the heart is not something that occurs all of a sudden. Rather, it is the consequence of a lengthy process, and the process itself frequently results in minor symptoms that we would not think to be significantly significant. But if we continue to disregard these signs, what consequences will we face? Imagine that your body is literally pleading with you to pay heed and take action right now. In point of fact, for every minute that you fail to perceive these warning signals, you are bringing yourself closer to dangers that you might not have known existed. What exactly are those signals, then? A month in advance, the following are the symptoms that indicate a heart attack. Now, we are going to share some important symptoms that indicate a heart attack. Number 1. Anxiety. The abrupt and inexplicable start of extreme anxiety that is similar to that of a panic attack might potentially be a sign of a heart attack rather than a panic attack. There is a possibility that individuals will have intense sensations of terror or a sense that something is horribly wrong, even when there is no obvious reason contributing to these feelings. It is possible for this fear to be accompanied by additional symptoms of a heart attack, such as chest tightness or shortness of breath. It has been hypothesized that this reaction might be the result of the body detecting that something is taking place on the inside. It is essential to recognize this as a possible indicator of a heart attack, particularly when it does occur in conjunction with other symptoms, in order to ensure that medical assistance is promptly administered. Number 2. Cold sweating. Another symptom that frequently manifests itself in the moments leading up to a heart attack is sudden and intense cold sweating. This illness arises as a result of the sympathetic nervous system, which is accountable for the fight or flight reaction, being overactive as a result of the stress that is placed on the heart. In response to the fact that the heart is having difficulty pumping blood, the body experiences a state of urgency and reacts by raising the amount of perspiration that it produces. Even when you are not moving or in a heated atmosphere, this sweat remains chilly and clammy. It is a characteristic of this sweat. A significant number of people who have this ailment also experience extreme anxiety or the sensation that something is amiss with their bodies. During the night, this cold sweat can also occur in certain people, which might cause you to wake up from your sleep. When your body is experiencing severe stress on the heart, this symptom is frequently an indication that it is doing so. Immediately seek medical attention if you notice that you are suddenly sweating for no apparent cause, and this is especially true if you are experiencing additional symptoms such as chest discomfort, shortness of breath, or weariness in addition to the sweating. Number 3. Sleep disorders. Sleep issues, such as an inability to fall asleep or waking up frequently during the night, are frequently early indicators of cardiovascular problems. This disease is brought on by a decrease in blood flow as well as an increase in activity within the sympathetic nervous system. Patients frequently have feelings of restlessness, typically have trouble falling asleep, and frequently wake up feeling nervous or short of breath. Changing sleeping positions is necessary for certain individuals because they experience symptoms such as soreness or discomfort in the chest while they are lying down. In the event that you are experiencing chest discomfort or exhaustion, this may be an indication that your heart is suffering from an abnormal state. The inability to sleep can also be caused by a person experiencing palpitations or an irregular heartbeat, both of which can make it difficult for a person to fall asleep. In most cases, this sleep disruption does not improve, regardless of how many different relaxation techniques you attempt. When this sleep disturbance persists for a number of weeks and is accompanied by other symptoms, it is recommended that you seek additional therapy from a medical professional. Number 4. Indigestion or heartburn. Despite the fact that indigestion and heartburn are frequently misdiagnosed as symptoms of a simple digestive ailment, they can occasionally serve as early warning signs of a heart attack. Pain, a burning feeling, or an unpleasant fullness are all possible descriptions of the discomfort that is commonly experienced in the region of the stomach. It is of the utmost importance to differentiate this disorder from the common indigestion or heartburn that may be brought on by the consumption of particular meals. It is vital to seek medical treatment if the condition is uncommon or chronic, since it is related with a heart attack and the pain does not often ease with antacids or other digestive drugs. Additionally, it may coincide with other symptoms of a heart attack. Number 5. Extreme fatigue. An extreme amount of exhaustion is a symptom that frequently manifests itself in the weeks leading up to a heart attack, particularly in females. This illness is brought on by a decrease in the efficiency with which the heart pumps blood throughout the body. As a result of blockage or injury to the coronary blood arteries, the heart muscle begins to weaken, and as a result, it must exert more effort in order to fulfill the requirements of the body. The body will send a signal of extreme exhaustion in response to the fact that the muscles and tissues are not receiving sufficient amounts of oxygen and nutrients. This sensation is distinct from the typical feeling of exhaustion. It is possible that you will find it challenging to carry out activities of daily living that were previously simple for you to complete, such as walking, climbing stairs, or simply getting out of bed. Despite the fact that you are getting sufficient rest or sleep, this lethargy will not ease. It is possible that, in more severe situations, the exhaustion will be accompanied by a sensation of weakness or an absence of energy altogether. If you encounter symptoms similar to these on a consistent basis for no obvious cause, it may be an indication that your heart is experiencing stress. Number 6. Shortness of breath. It is common for dyspnea, often known as shortness of breath, to be an early indicator of cardiovascular issues. According to medical terminology, this condition arises when the heart is unable to pump blood efficiently, resulting in the lungs not receiving sufficient oxygen to be distributed throughout the body. Additionally, shortness of breath can be brought on by fluid accumulation in the lungs, which is a symptom of congestive heart failure. During the early stages, it is possible that the only time you may experience shortness of breath is while you are engaging in mild activities like walking or climbing stairs. On the other hand, it is possible for it to happen even during sleep or relaxing over time. Orthopnea is the medical term for the ailment that happens when a person has shortness of breath while lying down. In order to breathe comfortably, patients frequently report that they feel the need to either sleep with their head elevated or sit in an upright position. Those are some of the indicators of a heart attack that you need to pay attention to. Our bodies are continually attempting to communicate when something is wrong, including before a heart attack happens. Don't dismiss the minor signals, as identifying them early might be a lifesaver for you or your loved ones. Remember that maintaining a healthy heart is our duty. Before it is too late, you should not wait. Take the time to be checked out, be aware of the dangers you face, and begin taking preventative actions from this point forward. It is important to pay attention to your body at all times since your life is far more precious than disregarding the warning indications. Have you found this video helpful? Please click the like button and subscribe to our channel so that you may watch further helpful videos that are similar to this one. Our goal is to ensure that you are healthy, so thank you for watching.